Bladder carcinoma. It is the carcinoma that arises from the inner surface of the bladder, and it is called as urothelial carcinoma that arises from the transitional epithelium of the bladder. This is further divided into three types: urothelial carcinoma, squamous carcinoma, and the adenomatous carcinoma. While the two later categories, they are the least one, while the majority of the cases, they are suffering from the urothelial carcinoma of the bladder. So there are classification of the grading of this carcinoma from mild, moderate to severe, or non-invasive muscular carcinoma, or invasive muscular carcinoma, or the carcinoma in situ, grade 1. When the cancer cell penetrate the basal membrane and passes into lamina propria, that is the stage, second stage. When it penetrates the muscle wall of the bladder and comes out of the bladder in the pelvic, that is the stage of third stage. And the final stage, which is metastatic, when the cells of the carcinoma break down into pieces, and that metastasis passes through the bloodstream and the lymphatic channel to the distant parts of the body, or the organs of the body. Now the treatment of the carcinoma is classical one, that is chemotherapy. It includes a group of medicines that are meant to kill the cancer cells. But these medicines have side effects. They also damage the nearing or the surrounding normal tissue also. So we switch to another category, which is called as targeted therapy. This includes a group of medicines which only target the cancer cells, only destroy the DNA of the cancer cells, while the normal surrounding tissues or organs, they remain in safe condition. Another group is called immunotherapy, in which these are the medicines which has no direct attack to the cancer cells, but they potentiate the capability and guide the cancer cell about the location of the cancer, guide the immune cell, that is immune system of the body, and guide the immune system about the location of the cancer cells. So they invigorate or potentiate give power, empower the immune system, that they destroy the cancer cells. Because cancer cells has a property, it secrete a chemicals which engulf the cancer cells. Protective layer, protective wall is made by this chemical material secreted by the cancer cells. So the immunotherapy includes the medicine which attack this wall and destroy and damage this wall and make passage for the immune system cells, that is T cell, B cell, CD4 cells, and they attack and approach and get access to the location of the cancer carcinoma, and they try to kill them, eradicate or devastate, to damage the and kill the cancer cells. So this is a procedure of chemotherapy. Next is the radiotherapy. Radiotherapy consists of the high voltage energy rays, including X-rays. These rays, they are transmitted from outside and also through the inner procedures by the radioactive isotopes. The machine is rotated around the body, especially around the pelvic area, and the rays which are produced, they are directed towards the bladder. And these rays, they try to destroy the, or the retard the, or the, that diminish the growth of the cancer cells. Next is the surgical manipulation. There is transurethral resection of the tumor cells through the cystoscope, but it is only performed when the cancer cell is in situ, that is only confined to the inner layer of the bladder. It has not penetrated deeper into the deeper layers, especially the up to the muscular layers. So this is the initial stage. By this procedure, we can excise, resect the and excise the tumor cells through the urethra. Next is the surgical open surgery. That incision is made above the pubic in the lower abdomen, and the open surgery is performed to remove the, it is either partial or the radical. In radical surgery, the whole bladder in total, along with surrounding lymphatics, prostate gland, vesicle, seminal vesicles, and the sperm carrying ducts, vas deferens. All these are excised by the surgical operation. Now there is keyhole surgery, that is called as robotic surgery, in which minor holes are created in the abdominal wall, and the surgeon passes the instrument through these holes, and there are also a lighting instrument is also passed and to visualize the interior of the pelvic cavity on the video screen, and surgeon performed by the instrument excise all these parts which are suffering from cancerous attack. So these are the procedures by which we can cut off, excise the cancerous bladder in parts or in total.